On to the latest on the coronavirus pandemic, and the number of patients who have recovered from COVID-19 in Africa has reached 1.31 million. This is according to the latest figures from the Africa Center for Disease Control and Prevention. The number of confirmed cases is 1.58 million, while active cases are just above 272,000. Over 38,000 people have died of COVID-19 related complications so far across the continent. Southern Africa has recorded more cases and deaths on the continent, followed by North and East Africa. Central Africa has the least number of infections. Meanwhile, the World Health Organization chief is speaking out against herd immunity, saying that suggestions it can end the pandemic are off the mark.
Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. It's scientifically and ethically problematic. Allowing a dangerous virus that we don't fully understand to run free is simply unethical. It's not an option.
Dr. Tedros also said health officials are still learning about coronavirus immunity and whether it differs from one person to the next. He said the aim is to achieve herd immunity through vaccination, since infection rates are less than 10% in most countries and third-party rights applicable to their territory. Well, let's discuss this further, and I'm joined by Dr. Ahmed Ogwell Ouma, the Deputy Director at the Africa Centers for Disease Control and Prevention. Dr. Ouma, thank you for joining us on Africa Live. Now, the number of patients who have recovered from the novel coronavirus in Africa has reached 1.31 million, a significant milestone for the continent. What do you attribute this to?
Thank you for having me, and good evening. We attribute the picture in Africa to the very effective response that countries on the continent took very early in the pandemic. We didn't wait for the numbers to rise. We reacted right at the beginning in February, and we have sustained public health measures throughout the continent. And this has ensured that fewer people are exposed, and with fewer people exposed, it means that fewer vulnerable people will be exposed. Secondly, we attribute this to the general efficiency of the public health system on the continent. Our hospitals may not be as advanced as elsewhere, but the public health system has worked, where we are using community health workers to ensure that correct information reaches the public, and the public has been responding in a way that has encouraged less transmission on the continent.
So public health measures seem to have worked on the continent, even though governments across Africa have now begun easing lockdown restrictions. The coronavirus still poses a significant threat, though. How can governments ensure gains made in the past months are not reversed?
Indeed, Africa needs to reopen because the economies depend on movement. As Africa CDC, we have rolled out a campaign to protect economies, livelihoods, and lives on the continent. And what governments need to do is to ensure that the surveillance systems are working. That way, anyone who is found to have the virus is quickly identified and removed from public so that the transmissions can be able to reduce. Secondly, is our health systems need to be strengthened so that any person who requires hospitalization can be able to be secured and looked after in a safe manner. Thirdly, is we must ensure that the public knows what they need to do to keep safe. Because right now the numbers are more, so the risk is more. We must ensure that the members of the public are playing their rightful place in ensuring that the transmission is reduced and eventually completely interrupted.
So there is a proposal for a herd immunity, even though Dr. Tedros, has spoken out against it. But there is a proposal that to tackle the spread of the virus, they should let it spread so that people get herd immunity. Is this a viable strategy for Africa, do you think?
Not at all. Herd immunity is essentially exposing a large part of the population to the virus. As we continue to understand this virus, one thing is clear, that the way it handles, the way us as human beings handle the virus is very diverse. Healthy young people are getting affected, and older, relatively unhealthy people are also getting affected. So exposing a large part of the population to this virus means taking the huge risk that a very large part of the population is going to get critically ill. And we do not have the bed space, the health system, the healthcare that can be able to take care of a large part of the population getting critically ill. Herd immunity is not an option in this context, because there are better things that we can be able to do, including public health measures that have shown to be able to work very well in Africa. Herd immunity is not an option for us.
All right, Dr. Ahmed Ogwell Ouma, the Deputy Director at the Africa CDC, joining us there via Zoom. Thank you.